Emergency rooms around the country are seeing a slight decline in post-holiday illnesses, but there's still viruses and gunk out there making people sick. Dr. Jeff Johnson is an emergency room physician with Hillcrest, and he is here to talk more about what's going around right now. Great to see you.
Good to see you.
It seems like, you know, during the holidays, we all spent time together. We're all indoors in close proximity. And I remember there was one week I had multiple family members, and none of it was the same.
Yeah, exactly. I think immediately after Christmas, we saw visits in the ER just, really increase with people coming in with viral illnesses, cough, cold, nausea, vomiting, diarrhea, fevers. And I just think, we were all together and it was great, but we were passing those germs around for the next little bit. And so, people are coming in sick and not feeling well, and just a whole assortment of symptoms and viral illnesses.
Is that kind of what we're still seeing today?
Yeah, we really are. People are still coming in, a lot of respiratory infections, and it's hard to put your finger on COVID, flu, RSV, and then the 10,000 other viruses that are out there that we don't test for or name frequently.
Yeah, we've seen also, I know a lot of people, COVID is, for a lot of people, would prefer it to be in the rearview mirror,
yes.
But you guys are still seeing it.
Absolutely.
And talk to us a little bit about those numbers. And I'm still curious, where once upon a time, stay home 5 days, don't be in contact with people. What are kind of what's the protocol now?
Yeah, so we're definitely still seeing people who are coming in with COVID infections. It's kind of a toss-up. Sometimes people come in and you think, is this the flu? Is this COVID? We test them. It's one or the other, but we're definitely still seeing COVID. Saw a couple of cases in the ER when I was working yesterday. Some people are still getting really sick, and we're still admitting some people who are having respiratory problems related to COVID. But overall, I think, if we come in, we get tested, there are treatments still available for both COVID and flu if they're diagnosed early.
Talk to us a little bit about prevention. I mean, obviously, a lot of us already had our flu shots. A lot of us got the COVID vaccine. But other than those inoculations, what is recommended? Yeah,
absolutely. Of course, getting your vaccines is the best way to prevent it. Outside of that, good hand washing, keep your distance. Both COVID and flu are transmitted respiratory-wise, not necessarily just through touching, so that's part of the issue why they're so infectious. But good hand washing, don't share drinks, keep your distance. If you're sick, stay home. Those are the most important things we can do.
Well, and oftentimes, the sneezing, the sniffling, the wiping, the touching, I mean, it can stay on contact surfaces, right?
Absolutely.
So you have to be wiping down the countertops, and especially if somebody, like all of a sudden you said you had two patients that kind of back up.
Oh, yeah.
Like all of a sudden I'm nervous for some reason. I do want to mention, we talked about the triple-demic. I mean, we had the flu, COVID, RSV following the holidays. So,
yes.
I mean, those are still the three main culprits?
Yes, and we were, overloaded with patients related to that, especially pediatric patients.
Right.
The state was really overwhelmed with kind of the RSV surge that we had. So, yeah, all of those things kind of at the same time really put a burden on the healthcare system.
It kind of was like a perfect storm that all came together. I know Hillcrest and the Tulsa Health Department just launched a couple of weeks ago the Don't Bug Me campaign that many of us have always seen on television. It's great timing, obviously. It's just a visual reminder. Talk to us a little bit about that campaign.
Yeah, so Hillcrest and the Tulsa Health Department have partnered with this campaign for years. Most people have seen the commercials around or the videos. So it's just a great partnership. We're really happy about it. It just promotes, flu shots, healthy behaviors to prevent you from getting the flu, and just kind of raises awareness for that.
I think it's just really important sometimes because we get so caught up in our day-to-day routine that we forget, and just these reminders are always helpful to make sure. Well, I appreciate you coming in.
Thank you.
Again, like I said, it's crazy when you have different family members, and I just keep walking through. I'm like, okay, stay away, don't cough on me, look the other way, here's a cough drop. It's always, it's just that time of year you have to kind of handle it.
Yes, it is.
Then we'll deal with allergies in the spring again, right?
Right.
Great to see you.
Good
Thanks for
seeing you.
coming in. Appreciate it.